Welcome to the Sisters in Loss podcast, a faith-based podcast that spotlights Black women that replace silence with storytelling around pregnancy and infant loss and infertility. Black women experience miscarriage and stillbirth 4 to 5 times more likely than white women in the United States, according to the CDC and NIH. Whether you've experienced a miscarriage, infant loss, or stillbirth, are trying to conceive, or have an infertility diagnosis, you will learn about resources and strategies to heal, gain clarity, peace, and hope, and find an empowering path forward after loss. I'm your host, Erica M. Freeman, and you'll hear me interview other sisters in loss from around the world who have healed from such a painful and traumatic experience by sharing their testimonies and stories to inspire and help others turn their pain into their purpose. Storytelling is powerful. Storytelling is activism. Storytelling is healing. Now let's get started. Welcome to the podcast.
Thank you.
I'm excited to have you. I would love to begin with you sharing a little bit about yourself and what you do.
So I'm Dr. Shayla Élise Walker. By trade, I am a licensed clinical social worker. I'm also a full-time tenured associate professor of social work, and I'm an entrepreneur where I do professional development and continuing education for high-achieving professionals.
Absolutely. We also have a background in that we both
Yeah.
worked at the Career Center at VCU, where both our alma maters, our undergrad alma maters, which is so crazy how God brings things full circle, obviously under these circumstances. But you have a story, and I would love for you to kind of take us back on your journey to motherhood.
Yeah, so it was a very interesting journey. So I was a little bit delayed in getting started on my journey to motherhood. So I got married when I was about 32, and I was in my doctoral program at the time. And I remember there was a semester I was like, I'm just going to drop out and start having babies. And so I was like, let me get through the semester, finish coursework. I'll be ABD. I'll take some time off. I'll have babies, and then I can come back and finish. But something just told me to keep going. So I finished my program. So that kind of resulted in a delay in us starting just because, and it was so interesting because I would get feedback saying, well, you can be a mom and finish your doctoral degree. I know somebody who defended their dissertation while in labor and giving birth. And I was like, that's great. It can be done, but that is not Shayla's story. So those are kind of like the strong woman messages that I was receiving. So by the time I finished my doctoral degree, I was so just exhausted from everything. I was a secondary caregiver for a couple of people. And so I decided to take some time off before jumping into that next big project. And so I did that, and it was so wonderful. But for me, parenting starts before conception. So my husband and I were having a lot of intentional conversations about, are we ready to be parents? What does that look like? How do we prepare? So fast forward to like summer 2025, we decided that we were just going to we were going to just stop preventing pregnancy. It's kind of how we said it. So I came off birth control, and we were just enjoying for a couple months. And then I realized, like, I was like, okay, no, I really want it. And so we started intentionally trying. So by last December, um, my husband and I had the unfortunate situation of being involved in a very severe car accident. I remember absolutely nothing about it. I remember being home, and it was 5:03 in the afternoon, and then I remember waking up in the hospital. There's no memory in between. So everything we know about the accident has been pieced together through the investigation. But essentially, we were rear-ended by a very large vehicle hauling a trailer. Both of us were unconscious at the scene of the accident, and at one point it was reported that we weren't breathing. So with all the medical procedures, they gave me so many medications, x-rays, CT scans. I don't remember any of it. But when I do remember coming to at the hospital, at least when my memory starts again, I remember I kept asking, have you checked? Have you taken a pregnancy test? Because we've been trying. And I had started feeling a couple symptoms, so I was kind of hopeful, but it was that weekend where I was going to be taking the pregnancy test. So I was like, did you do it? Like, stop giving me medication. Like, what are you giving me? I might be pregnant. And so when I was admitted to the hospital, I was on the trauma ICU unit. And that's when I found out that, yes, you are in fact pregnant. And I was so excited because I didn't know a lot of the details about the accident then. I just knew we were in a really bad accident. I was hospitalized. I had a neck brace on. My head was pounding. And they told me that I had a mild concussion and brain bleed, torn ligaments in my neck, and a fractured spine. But I was like, and my husband was okay. He had a major concussion and brain bleed, staples in his head, stitches. But he was recovering as well. He had more of the brain trauma. And so I was like, I survived, my husband survived, but then also our baby. What a miracle that is. This baby is supposed to be here. And so I was peaceful the whole time I was in the hospital, even before finding out that I was pregnant. Um, but anyway, so we were hospitalized, and I remember with every medication, I was like, is this safe? I'm pregnant. Is this safe? So everybody knew I was pregnant. And I was really prioritizing my child. If it was not a life-saving procedure, like, don't harm my baby. And so I was discharged a couple days later, started making all the preparations. And then so when I was discharged, they estimated that I was about 3.5 weeks pregnant. And so about 5 weeks later, we had our first obstetrician appointment. And that's when they told us that it was not a viable pregnancy. They called it a blighted ovum, which also is referred to as an anembryonic pregnancy, where the pregnancy stops progressing before the baby officially forms into an embryo. And it was some of the most devastating news because I was so excited to meet our baby, and just to hear the heartbeat. And I remember the weekend before the appointment, I started getting anxiety, and I was like, baby, just hang in there. I just want to see you. I just want to hear your heartbeat. Just hang in there. And I thought it was so weird that part of me was like, had that fear of, I hope everything is okay. So I don't know if that was intuition or if that was just anxiety, but I was like, please just let me hear your heartbeat. And I remember the day of the appointment, I wore the maternity sweater that my mom had worn with me. I wore my late grandmother's perfume. I wore a necklace that I shared with my sister. So I was like, I mean, I was dressed for meeting my child and introducing this next generation. And so to find out that it was not a viable pregnancy was the most devastating thing of this entire process. There was anger, there was fear, there was question, there was also so much empathy. Because some of the questions we asked are, to what extent did this accident contribute to the miscarriage? And they said there's no way of definitively knowing. But my doctor said, but if even so much as your blood pressure dropped, your body's going to naturally save yourself first. And I'm like, well, there was the impact. I was unconscious. I was not breathing. So I'm pretty sure my blood pressure dropped. They had also given me fentanyl and oxy. I had so much radiation from the CT scans and x-rays. And I'm like, I can't rule this out. Like this, that seems to be a larger contributing factor than a chromosomal insufficiency, but there's no way of knowing. And I remember just being so devastated, but also I still go back and forth. I don't know if it's in some ways a relief to have something to blame because I don't want to have to blame at all. I want my baby, but I really hold space for all of the people who, you know, don't have an incident to say this is probably what contributed, like just to have a miscarriage. I can't imagine that pain either. And there's no point in saying like which would you prefer because you would never even think of any of this actually happening to you. So in our healing process, we were also very much grieving, I will say predominantly grieving the baby that we lost.
My goodness. I can imagine just the what ifs that you have in all these
Mhm.
scenarios, even in your asking the doctor about just the impact of had that played a role in why the pregnancy became a blighted ovum versus it actually fully developing. Obviously, we won't know and we will never know the answer to that. But I really want to talk about how you all both have been grieving, particularly how you all have been grieving differently. Because I think that when couples go through something traumatic like this as a whole, like
Hmm.
any type of
Hmm.
accident, any type of trauma that we have is an imprint on us, but you all went to that together. And
Yes.
then on top of the accident and the trauma from that, having to experience this heartbreak of losing a baby, it's
Mhm.
almost like a double whammy in a short period of time. So I would love for you to talk about your own personal grief. Obviously your husband, your partner's not here, but also just talk about how differently you both had to grieve this
Mhm.
traumatic experience of this accident, but also this loss.
Yeah, this grief has man, and I'm new to grief. So last summer I lost my grandmommy, and that bout that was hard. And I was like, oh my, that was my first true experience of losing somebody I was really close to. And so to follow that with my child, um, man, it was just so raw. All I can think of is I was talking to a friend and she was sharing a different story of something that had happened locally. And these mothers had lost their children. And she said from her apartment, she could just hear that like guttural scream. And I just kind of like nodded, like, yeah, I know that scream, right? It's just wailing, just my baby, my baby, my baby. Like it just it does something to you. And I still do consider myself a mom. I do have a child. My child's in heaven. I just never had the privilege of meeting them flesh to flesh. There's been a lot of different ways I've tried to learn to cope. In some ways, I'm grateful that my child will never know pain. But selfishly, I really just want my baby. I really just want my baby. Um, so my grief was definitely very visceral. Um, Staying in bed, lots of crying, just um, random, unsolicited, unprovoked outbursts of just tears and crying and screaming, to the point where my husband and I just kind of inherently developed a routine. I'd just be in bed and he will just go and get a weighted blanket and just lay it over me and let that kind of soothe me, as I release all my tears. And well, not all of them, because there's no way to, I will mourn my child for the rest of my life. Um, wondering the what if, and then in my grief, navigating various messages that I was receiving, messages that all were so well intended and meant to be comforting and to express hope. But the whole, oh, well, I know this is a really hard time, but I hope eventually you will be comforted in knowing that at least you can get pregnant. I'm sure when you try again, you'll have a healthy baby, which I appreciate those messages, but I'm not thinking about my next child. I'm thinking about this child. Um, so just messages like that, or, questions about, well, does it make you feel better that it wasn't an embryo? And, people saying, well, are you grieving a loss of life, or is it just a loss of pregnancy? And like just really minimizing my experience and what this is, even though I was clearly grieving. I was clearly using language to say, I miss my child died. And they're still asking me, well, you're just sad that you're not pregnant anymore. And I'm like, that is a very um unfair sentiment to try to like add to somebody when you've seen me in my worst. You've heard me in my biggest grief episodes. And so for you to reduce it to that, um, I'm navigating all of that through the grief. And as far as my husband, I mean, he is my rock. He's my person. We met when we were 15. We've been best friends since we were in our 20s. Um, and when we first found the news, I think in the doctor's appointment, he was kind of in denial, like, oh, well, like, let's just see, or like, it could be, maybe we were just early. And, I don't think it really clicked for him and still until we started getting more of those results. We went back for a second ultrasound about a week and then 2 weeks later, and there's still no results. And then when my hormone levels started dropping, that's when it really hit home. And I just remember us crying in each other's arms, really figuring out how are we going to share the news. But um, I love my husband so much. And one of the things that I love about our relationship is that we can be vulnerable and honest and authentic. And he was able to name that this experience of losing our child was going to be different for me because I was carrying the child, right? It was so new that it still hadn't really hit home that he was a dad because, mind you, we had the car accident. We both had memory loss. My husband was hospitalized in the trauma ICU for 7 days. He remembers none of it. He doesn't remember the days leading up to the pregnancy. He doesn't remember his hospitalization. He doesn't remember me telling him that we were pregnant. So it was all so new. And we were only, um, he was less than a month out the hospital when we found out we were miscarrying. And so it was just a lot back to back to back, navigating our injuries, our physical injuries, our brain injuries, the miscarriage, trying to keep me healthy, trying to figure out what happened in the accident. It was just so much going on. But he was my rock, he was my center. And we had really honest conversations because I asked him, I was like, how are you feeling about this? Because you have been so strong for me, but what I don't want is for you to be strong for me. But then you go into your office or you go into a quiet area and then you're grieving quietly to yourself. I want to be there and support you too. So we've had a lot of those conversations. But yeah, it's been quite the experience. And so I will forever grieve my child, but now I'm also dealing with the fear of what if I have another miscarriage? And if I have another miscarriage, does that change the narrative for well, was it really the accident or was it me? And I'm just trying to stop those thoughts because for me, I'm ready to be, well, I am a mom, but I'm really ready to parent my child flesh to flesh. And so I'm leaning into that to keep trying and to really embark on this journey, holding space for what happened, but also recognizing it was two completely different pregnancies, or it will be two completely different pregnancies. And what happens with the second one has no implication on the first one because that is my child. They are in heaven. And they are forever my baby. And they are up there with my grandmommy. And she is caring for him and cutting up his grapes and things like she cut up my grapes. So he's good, right? And he's fine. And I use that to comfort me, especially in my deep moments of grief.
I love that. I love that. I always think about the ancestors who welcome our babies into heaven once they came. And I always think of there's a movie, I can't think of the name of it right now, but it always comes to my mind when I think of kids who've passed away early, that they're all playing together in heaven at the age
Mhm.
that they would be.
Yeah.
Smiling down on us, sending us little shimmers and sprinkles through, the wind, the grass, things growing, the butterflies, the birds, like just
Yeah.
to let us know that they're here, like they're here, they're around us, and that we are the living memory of our babies. I think the hard
Yeah.
part too that you just talked about, the struggle, is really going from, honoring and recognizing that, that your baby is in heaven, but the realization of, what does it feel like to be a mom here? And what would this
Mhm.
pregnancy, a new pregnancy, be like?
Yeah.
So I would love for you to talk about more about this thought process of what it takes to try to conceive. Because I think people think it's easy. It's not easy. Easy in the sense of, yes, you have 6 days a month that you are ovulating, that you can get pregnant,
Right.
right?
Right.
Easy in that sense, but there is more of an emotional and mental
Mhm.
challenge to it,
Mhm.
because it's one thing of, doing the thing, having a great time with your partner to get pregnant, but then when you actually are pregnant, what comes of what fears or anxiety or worry or stress
Mhm.
that may come over you as you're navigating
Yeah.
through a new pregnancy, especially when you've experienced loss before. So I would love for
Yeah.
you to talk
So
about that, because that is hard.
that's
It's such a hard process to think
it's
about and
hard.
really work through.
It's hard. It's so hard to separate the two. So my husband and I have started trying to conceive again, and it's hard for a couple reasons. Um, First, when I first lost our baby, um, I was really thinking about the language, and so there's my first child, but then there will be my firstborn child. right? Just because I will always honor the baby that we lost. But then also, kind of like I said, I'm grieving my child, but I also have the fear of what's to come. But I still am like really, really focused on I want to be a mom to a child that I'm able to meet flesh to flesh. And so there is the fear, even in overcoming miscarriage. I have family members, I have friends who we were all pregnant at the same time. And so then there was a fear that kind of extended to them, like, please let them be healthy. Please let their babies be okay. I don't want them to experience what I just went through. I can't imagine what that would be like. I don't want to have to, like, there is just, so the fear is not just about my own experience, but for other people who are going through this process of parenthood, really hoping that my experience is only my own and that they all have healthy pregnancies, healthy deliveries, healthy children, that they are healthy after the delivery. And so, yeah, I remember I was talking to a friend who had had a miscarriage and then has her baby now, and she said that when you try a second time, it in some ways seems to take the pressure off because every at least for both of us the first time we were reading all the pregnancy books, we were doing everything by the book, and we still lost our children. And so she was like, it's a little bit easier to just kind of stay centered because like, okay, well, if I did everything by the book and it still didn't happen by no fault of my own, I don't have to stress myself out about these do's and do nots. And so I say that to say for my first pregnancy, I was doing everything by the book. Like for months previous, I was like limiting my caffeine. I wasn't drinking any more alcohol. Like I was being very mindful of everything. And then with the loss, I did start drinking again. I don't drink a lot, like maybe like a glass of wine at dinner or things like that. But I think it's also important for me to say that I do have a mental health history. Like I have a history of depression. I have chronic PTSD, ADHD and anxiety. And when I was diagnosed with the ADHD, they said I had OCD tendencies, which I was like, no, I don't. And as a clinician, I'm like, no, I'm rebuking that one. I get everything else, but no. But it was actually this morning that I realized, oh my goodness, I do, because I assign meaning to different things. Like I was telling my therapist literally yesterday that that I'm trying to, just be dry again, like not drink any alcohol. Um, but I still will when I know that I'm not pregnant. Like when I'm menstruating, then I'll, have a glass of wine or things like that. Um, but I was like, when I do, I recognized that part of me was telling myself or wanted to tell myself that if you can't be disciplined enough not to have a glass of wine, how can you be a parent? And I was like, that seems like a very unfair thing to tell myself. So I don't want to lean into that narrative, but I also have these thoughts of like my therapist calls it magical thinking, right? Where I'm assigning meaning to these things that may not have. So that is part of the like, can I do this? Like, okay, well, I just ovulated 3 days ago, can I go get this, Mountain Dew, or can I go to Starbucks, or should I not? But then also recognizing that having a cup of coffee or drinking a glass of wine, especially in the beginning, or whatever, it is not like, oh, this is going to guarantee a miscarriage. It just, like you need to be mindful of it. And there's one book that I really like, which of course I've tucked away since our loss, but I'll have to think of the name of it, but it talks about like the myths and facts with pregnancy and what actually is like an appropriate amount of caffeine and what does the research say about it. And so you have a more open, like honest critique of the do's and don'ts, because the foundation of that book is you as a mom or you as a parent should be able to make a choice as you are pregnant with your child. And that's one of the things. They say don't blame yourself when you have a miscarriage because it's not your fault. But after going through everything, and I remember asking all the medical providers, is this medication safe? There was a muscle relaxer that they were giving me. And I asked every single provider, nurse, doctor who administered it, is it safe for pregnancy? And they all said yes. They discharged me with it, take it as needed. So everybody said it was safe. I get to my first PCP appointment, and the first thing she says to me is, you're not taking that anymore, right? Let's not take that. And now I was like, oh my goodness. Okay, well, I'm not taking it. And then when I had the miscarriage, I looked it up And the first thing Google says is don't take when pregnant, especially early in pregnancy or if you're past 20 weeks. And that just added to my anger and grief. And it was hard. Like at first, it was they killed my baby. But then the narrative shifted to I killed my baby because I was like, why did you not think to just look it up yourself? But at the same time, I knew I had to show myself grace because it's okay to trust medical providers. And I was going through a lot, which is why I didn't think to look it up myself, but it also kind of changed how I will think about things. So for my next pregnancy, I probably will have some, like just naturally some level of hypervigilance. Like, is this okay? Let me do my own research in addition to medical guidance, because for me, even though it might have been fine and it may not have led to the miscarriage, I felt like by always asking, is it safe? I was essentially saying my child is my priority. I will go through whatever pain I need to. This is not a life-saving medication, so I need my baby to be healthy. And I felt like that was ignored or just not honored in the way that I would have liked to be. And if they had a conversation like is not the best, but if you are still going through this, your body needs to be healthy first. So we have to relax your muscles so the baby can da. But don't take my choice away, right? And so I think that's still some of the narrative that I'm carrying on, but also trying to separate the two and just trying to be positive and hopeful. And, I've looked at the stats and they say like you can have a miscarriage, but the likelihood that you would have two consecutive is lower and da da da. So I try to find ways to comfort myself, but ultimately God is in control. And I never want to experience another miscarriage, but for whatever reason, this is part of our story now. And so we'll see what's to come.
Absolutely. And I love that you want to get that research and knowledge and not trust. Not saying that our medical providers aren't competent to give
Right,
you
right.
information, but it's good to make an informed decision based on what you want to do with your body. And
Yeah.
now I always feel like, loss makes us even more hypervigilant about medications we're putting in our body, even down to like lotions and creams and oils that we're putting
Hmm.
on our skin, because our skin is the biggest organ in our body, and we want to make sure, hey, I hope this isn't changing anything hormonally that could have an adverse impact on me trying to conceive, but when I am pregnant, how this pregnancy is going to continue on. So I think that when it comes to women's health, really, as our overall, really health as a whole, we all have to make sure that we're doing the right thing for ourselves and our bodies, and know that there's more than one option. Because
Yes.
they're like, oh, we're going to give you just this one muscle relaxer. There's probably a couple more muscle relaxers that they probably could have offered that probably would not have had any impact to pregnancy, even though they said, oh, it may have a little, or no, I don't think it will. No, they probably could have gave you a couple more options. So I think that that is good
Right.
that you're going to do that in this next pregnancy, and look at more books and research, especially as the pregnancy continues on, as you
Hmm.
get further into your pregnancy and past
Hmm.
around that same time that you had your miscarriage. So I would love for you to leave our listeners some encouraging words. Those who are in that same place where they've had loss,
Yeah.
they are in this trying to conceive journey, they may be apprehensive about what a pregnancy after loss may look like. What
Yeah.
encouraging words can you leave our listeners?
I think having questions is normal, it's natural, it's healthy. Um, to me, it also shows the investment that you have in parenting. Um, so lean into it, but don't be consumed by it, right? Like it's what we went through. I'm understanding more and more why they say it's a traumatic experience because it just sticks with you. Um, but recognize that each pregnancy is unique in itself, just like every baby is its own, it's its own spirit and its own being. So I feel you, and I'm not here to silence or dismiss the fear that comes along with trying again. My husband and I are trying again, and I have questions of will I conceive as quickly as I did the first time, and am I able to conceive again? I've had the anxieties of like, what if that was my last egg? So those things are normal, but I say um, enjoy life. I probably shouldn't say this part, but just as a therapist, something that we often say is stay where your feet are. But I have a fairly high libido. So now when I hear that, I say, I want to stay where my feet are. And in this moment, I want my feet to be in the air. Okay. So I'm ready. So forgive me for saying that. My husband's probably going to be like, why did you say that? But, but bring humor into it, love on your partner. This is an experience for both of you. And one thing that I truly, truly appreciate about my husband, he told me even before we conceived, and especially after we lost, he said, I married you because I wanted a life with you. And the child we have is a product of our love. So please lean into your partners, lean into your supports, go to therapy, find safe spaces to gather and be in community about this experience. I have found that the community of people who have lost children is vast, but it is such a special group of people. And it's like a wonderful membership that you never really wanted to be part of, but there are so many wonderful people there. So lean into them. There are going to be people who may not understand your experience. Mother's Day was not that long ago, and I was like, it's going to hit different. And most people didn't understand what that meant, but there was a part of me that was crying out to be acknowledged. I'm a mother too. And I did get some messages, just holding space for me and honoring, but you know, ask yourself, what do you need in this space? How can you care for yourself? Who are you comfortable with communicating that with, if anybody at all? Lean into your support groups. This podcast, this group and organization, Sisters in Loss, has been absolutely amazing. So if you're feeling alone, reach out. There are grief and loss support groups. There's therapy. There's a lot of different things, but you're not alone. Keep trying, honor the baby you have, and celebrate the one that's on the way.
Absolutely. Where can we connect with you after this episode? I know people are going to want to see this journey. We're going to see this miracle and this testimony on this other side for you. Manifested.
Yes, we are. I'm excited I'm so excited for it. So the best way to follow me, I'm on TikTok and Instagram as at I am Shayla Walker. And then you can also go to my website, shaylawalker.com.
Thank you so much, Shayla, for being on the podcast and having this full circle moment.
Of course.
I mean, I'm like, girl, we were like in college, in a career center.
We were.
Trying to help with people with resumes.
Yes, yes, we were. And it was honestly my therapist who sent me this order. And I was like, oh it's Erica.
Oh, really? See, it's so interesting because I have a support group that we do every Thursday, and it's so many therapists that send the group. I'm like, oh my gosh. Like one girl we had on last night, she had just had her loss last weekend. And I'm like, wow, like what an honor to hold that space with you. But
yes.
I can't imagine like having a loss and then going straight and being bold enough and courageous enough to join a support group so fast. But we held space for her and all the other ladies. So I'm so thankful for your therapist.
At the same time, I think that would be needed, right? As soon as it happens, where's a safe place where I can process this and know that I'm not alone. So I'm glad she was connected to you.
And I think that's the hard part because we think we got to hold back our tears. And I'm just like, girl, it's all this is the only place on the internet where you're going to be around all Black women who have gone through the same thing. Your tears are welcome. We know what this feels like.
Yes.
We know this rawness feels like. We know what the rage feels like. So I'm incredibly honored. Kudos to your therapist for recommending Sisters in Loss. and kudos to you for having a therapist who have therapists. Come on now.
Yes, please don't get me started on that whole other rant.
Oh, that's a whole nother rant for a whole nother day, right? Yes. Especially what's going on in the zeitgeist. But thank you so much, Shayla. I appreciate you.
Yeah. Thank you for having me.
Thank you for listening to today's episode. For show notes, go to sistersinloss.com. To stay connected with us and join the Sisters in Loss community and receive my weekly newsletter, please go to sistersinloss.com/newsletter. That is sistersinloss.com/newsletter. Please rate and review this episode, and I will talk to you next week.